is a big problem. Another name is Mongol baby. Now, tests are available. The best test can be done, which is called a dual test. It is done at 12 weeks. 3-4 days earlier than 12 weeks it has to be done. There is a blood test and there is a ultrasound, which is called an NT-scan. Now in NT-scan, doctors sees very carefully the face of the child, the NT thickness, and gives a recording and a films. At that particular time, this test is done, and the accuracy of these two tests combined is something to the tune of 90 to 92%. One can know for sure that this child does not have these problems. Roughly, you should know that in case if 100 women are scanned or screened, only 10% will be positive. Now, in this 10%, invasive test has to be done, which is called an amniocentesis. This is done around 16 weeks of pregnancy, and here the fluid around the baby is withdrawn in a small amount. There are two tests are done. One is called DNA probe test. Here the report is available in good 48 hours time, and with the accuracy of 99%, they can say that your child is okay or your child is not okay. 1% time it probably can miss, and that's why we should wait for the culture, and the culture report invariably comes in a month's time. In all cases, you find that the culture is not positive, and something can go wrong that the culture does not grow. Otherwise, in a significant number of cases, you have to pick up the report of amniotic fluid culture, where for 100% you are sure that your child is okay or not. Now, unfortunately, now there's another test available, which is we call a test, which is again a blood test. It's not an invasive test. This is called NIPT test. It's a non-invasive test where the fetal cells circulating in the mother's blood are picked up, and they can tell to the accuracy of 99.9% that these tests are not there or it is positive. So I think, where we find very high risk pregnancy, this test is expensive. It costs something like 25,000 rupees. But in high risk cases, probably the money does not matter, while the other tests are not that costly, and they are done within a range of 5,000 rupees. Both things are done. So I feel once you find out that there's an unfortunate situation, that there's a Down syndrome, then in that case, the pregnancy can be terminated according to the law of the land up to 20 weeks of time. In case you find that the report has come a little later, then in that case you have to refer these patients in the city of Delhi to All India Institute of Medical Sciences, because by the government law we cannot terminate pregnancy beyond 20 weeks of pregnancy. In a bigger institute like this, there can be a body way, they can sit down, and once you're confirmed case of Mongol baby, the decision can be taken and the pregnancy can be terminated. So that's all about knowing the dual test and how it can be prevented. Now the tests are available, and